Well, there are calls for a national public inquiry into Canada's response to the pandemic. Experts across a variety of sectors, including healthcare, law, and humanitarian studies, say now is the time to take a critical look at how governments responded to COVID-19. A series of articles in the BMJ Medical Journal identifies various shortfalls, including difficulty reaching vulnerable and marginalized populations who were most at risk, catastrophic deaths at long-term care homes, and inconsistent public health messaging. The Ford government responded to calls for a national public inquiry.
Everyone went through challenging times, not just here in Ontario, but around the world. I want to thank all the docs and the nurses, frontline healthcare workers, and everyone else that pitched in. I found it very interesting. CBC said, out of all people, CBC, nothing against them, but said we ranked number 2 in the world, next to Japan.
Well, for more reaction, we are joined by Associate Professor at Ontario Tech University and long-term care advocate Vivian Stamatopoulos. It's been a long time. Thanks for joining us on CP24. I know you've been, you were very outspoken. You were on our show, several times throughout the pandemic, speaking out on behalf of, long-term care residents. Do you support this inquiry? And if so, what do you think it will highlight that we don't already know?
Of course, I would support anything that looks into actually holding people to account for what happened, because as you said, I was on this show and other shows far too many times documenting the widespread failure. And a lot of it was, systemic failure that was clearly preventable, and all it took was some more stringent and speedy and expeditious government actions in order to improve it. And we didn't get that. So, the things that they're calling for, the things that we have been talking about for, all throughout the pandemic, but decades. So I don't think we're going to necessarily hear anything new. But if it puts the onus and lights the fire, under people's derriere, so to speak, to do something, then by all means, keep documenting the evidence of the flagrant failure that occurred in Ontario, particularly, but also across Canada.
Do you think these findings would, better prepare us for any future pandemics or outbreaks?
Well, the researchers that wrote these reports even said we have, over 100+ long-term care reports, systemic structural reports documenting, how at crisis this sector already was pre-pandemic. And all throughout, we have the evidence of where we went wrong from a pandemic approach and things that we should have learned from SARS, but we didn't. So, yeah, any more research and documentation of how all of the provinces, so to speak, messed up, because, I obviously documented how Ontario really dropped the ball, would obviously be good. But it also highlights, and these researchers made a point, and points that we have talked about as well, that, the Canadian government doesn't really enumerate long-term care statistics. We don't document the well-being of the workers and the residents in these facilities. We give money to the provinces. We often match funds for them to then put their own funds towards balancing this sector's budget, so to speak. But we don't actually know anything. We weren't documenting how many Canadians in these facilities were actually dying. It took other organizations, nonprofit groups, to do it themselves. So it really shows the flagrant gap in documenting evidence across this sector. And that's often tied because it was left out of the Canada Health Act proper, like acute care was. So we have work to do.
Yeah, one of the shortfalls they also touched upon was the inconsistent public health messaging. And Vivian, regardless of what people's stance are on vaccines and COVID-19 and how you're able to catch it and masks, there was a lot of messaging that was a little bit mixed, and a lot of people obviously took that to heart, and they, base their opinions on what they heard from many people who came on news programs. And I'm curious, when it comes to the messaging, what do you think needs to improve moving forward so that people really, kind of get, are able to make an educated decision, an informed decision about their health?
Yeah, you're absolutely right. This was one of the biggest failures in public health proper, in that we didn't put in the resources to actually provide these sufficient campaigns. And what we saw, and I talked about this recently, but what we saw in terms of, during COVID, people were at home, people were alone, people weren't being provided a lot of information, a lot of access to resources. So where did they go? They went online. And then they got effectively, many people got pulled into conspiracy theory holes, rabbit holes, and started getting information from unreliable sources. And that's taken a big toll on public health and vaccination uptake and et cetera. So we certainly need to do better at a Canada level, at the national level, forget the provincial level, because we have unreliable sources. And there's, I don't want to be one of these people, these Twitter people that has to come on here and provide this information, but there's been a lot of, so to speak, COVID influencers that had to come and do this work because it wasn't being provided efficiently by larger public health organizations. And that's not ideal, right? We don't want to have to go to social media to get our information. We should be going to governments to get it.
Vivian Stamatopoulos, we appreciate your time and perspective as always. Great to chat.
Anytime. Thank you.